Now on to live updates. In Canada, protesters complain about COVID restrictions as case numbers rise. Bureau Chief Thomas Likeness joins us tonight. Thomas?
Thank you, Anna. Well, I've got to wonder, what does it take? For the past week, coronavirus numbers in Canada have hit record highs. Scores of people have died, and some people don't seem to think this is a serious situation. I mean, fortunately, they're in a minority, but they are also the ones that can transmit the disease and have the potential to become super spreaders. I'm just so frustrated when I hear about things like this. On Saturday, yesterday, in the province of Manitoba, a group of about 200 people, they call themselves Hugs Over Masks. Sweet sounding name. Hugs Over Masks. They decide to stage a protest. Now, Manitoba that day reported a record number of deaths, 15. This protest was staged in the small city of Steinbach. It's just a stone's throw away from the capital of Winnipeg. What seemed to be bugging these people? Well, they don't like the government's public health orders to slow the spread of this deadly virus. Now, in that city of 21,000, Steinbach, Manitoba, there were 263 active cases on that day. Across the province that day, 15 people died of COVID. The emergency room in that city is so crowded, so many people coming there that nurses are doing triage in the parking lot. So what are these people thinking? They say they don't like the fact that gatherings are limited to 5 people. They don't like masks. They don't like to be told what to do because I guess in their minds, this isn't a serious illness. And they think they know more than most doctors. One of them even told a television network she's upset because she can't get together with her friends like she used to. And all I can say to that is, boo-hoo. Others that were out there touting their conspiracy theories, the tinfoil hat gang strikes again. Well, authorities handed out lots of tickets. Haven't got an exact number yet, but the fines are just under $1,300. For those of you in the Philippines, that works out to more than 47,000 pesos. Maybe that will help the message sink in. The scary part is this type of thinking isn't just limited to Steinbach, Manitoba. It's going on across the country. Small pockets of people, they're just a minority, but that minority is dangerous, and I'll tell you why. It's because they don't take the precautions, and as a result, others that do get infected. They worry about their rights being violated. Well, perhaps they should consider this. This quote attributed to Abraham Lincoln. He said, "My right to swing my fist ends where your nose begins." Now, I know the EBC audience doesn't need to be reminded of this because you're all responsible members of society, but you're probably just as frustrated as I am watching the antics of the few. While we fight this pandemic together, I wish you all good health. Remember to take care of others. Take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Thomas. You're absolutely right. I wish we could just all, be on the same page as far as the pandemic and, that it is real. And if we all just do our part, it will get better, faster, right? I was wondering,
it's just so frustrating.
Yes. Canada's population is a lot smaller than ours, a little just, if I'm correct, maybe a little over 10%, right? So the case numbers are smaller. So just how bad is it there?
Okay, as of today in my province, there's only about 12 more intensive care beds left for COVID patients. And once those are gone, it could affect the healthcare needs of others. And I'm talking about heart attack victims. The accident victim who suffered severe trauma in a car crash, people who have other serious medical issues, people who suffer complications from surgery. Where do they go? In Saskatoon, Saskatchewan, it's so bad now that they're reserving those intensive care beds just for people who live in that city. They won't accept out-of-town patients anymore. And they are shipping patients out of town who are less severe, who are able to be transported because again, there's just not enough space. COVID patients need that kind of care once they get that seriously ill, and that's really putting a strain on our healthcare resources.
Yes, I mean we're starting to hear stories, similar stories again as when the pandemic started, with hospitals not being able to handle all the cases. What about there? Are hospitals still able to cope, Thomas?
Well, most in Alberta and many other parts of the country have begun to reduce the number of elective or non-urgent procedures they can do. So, for example, you have a bad knee, you need a knee replacement. You've been in pain and on a waiting list for a year and a half. Now, it's going to be longer now before you can get in. 9 hospitals in my province are coping with outbreaks within the hospital of coronavirus. Now, that means staff who have been in contact with infected healthcare workers, they now have to quarantine. This results in staff shortages. In some cases, though, the health department is allowing asymptomatic staff who tested positive to still report to work. There's also mandatory overtime to cover shortages. And I'll tell you, this is just creating a lot of stress for doctors, for nurses aides, for anybody involved in that hospital setting.
Yes, so we need to continue to support our healthcare workers. They're being stretched far more thin than in the beginning, I would say. Well, thank you, Thomas, for your report. It's always a pleasure to have you on.
Thank you, and you take care.